Today on Fox 11 News In Depth.
Extreme fatigue where you cannot even get out of bed.
It's been one of the worst flu seasons in years. We thought it had peaked, but maybe not. We'll talk with doctors on the front lines. Fox 11 News In Depth starts right now. Well, it's flu season, and it's been a bad one. When we come back, we'll talk about whether you've had those sniffly, achy, miserable symptoms and whether, you can still get this again if you've had it, or if you can get it if you haven't had it. We'll be right back.
Extreme fatigue where you cannot even get out of bed. It's a lot of low back pain, nausea, some vomiting and diarrhea, along with the other upper respiratory tract infection symptoms like runny nose, sneezing, headache.
You may have had those symptoms yourself. This has been a very difficult flu season. Two strains out there, influenza A and B, have proven deadly in some cases. We thought it peaked last month, but that may not be the case. We're not exactly sure. We brought in the experts to get more of a handle on this. Joining us this morning are Dr. Suman Radhakrishna, who is the Director of Infection Prevention at Dignity Health California Hospital, and Dr. Jennifer Sudarsky with Santa Monica Urgent Care. And first of all, let me sort of break it down this way. You see flu patients first because they come to the urgent care, right?
That's right.
And so what kind of experiences have you been seeing? And are we seeing an increase again? There's some who say there was an abatement of this, and now there's some saying this is another peak. What's going on?
Well, just when I start to think that things are slowing down, the next day there's a wave of new patients. I talked to my colleague at Anaheim Urgent Care, and they saw 125 patients with the flu yesterday. So,
yesterday alone?
So they're seeing daily, they're seeing over 100 patients.
125 patients in one day, that sounds like a lot.
It is a lot. There's more than one physician there. That is a lot. And they also see patients from Disneyland.
Right, but I guess my question really is, are we at a peak, or did we even have more in a given day last month?
I don't think we really know the answer to that yet. I mean, people are still dying. We're up to 63, deaths so far. So,
and there have been some new numbers on young people as well, and that's been very difficult. I know that you, doctor, have had a couple of patients that you lost. Now, you deal with these patients once they get admitted into the hospital.
Yes, once they get admitted to the hospital, and I'm in consultative infectious diseases, so the primary care physicians call us to see patients who are sicker than what they can handle.
Now, you had a patient, we talked about this earlier, you had a patient that was elderly, and this does affect the elderly, and it could be in a deadly way, but you had a 28-year-old. And that's not something we hear about all the time. What happened in that case?
The younger patients are the harder ones because they think they're all right. They have never had any medical problems. It's just a cold. It's maybe the flu, and I'm bigger than the flu, and I can deal with it. And by the time they come to the ER, they are pretty near collapsing. They have low oxygen levels sometimes, and in this particular person's instance, we ended up having to put him in the ICU, put him on a ventilator, and we were still unable to oxygenate him adequately. We tried our best, and it wasn't good enough, unfortunately.
Very unfortunate. And we had the case, of course, of the teenager in Ventura County that sadly lost her life, and you know a little bit about that.
We just have friends in common, so
and what's your sense of that when
tragic.
You have a teenager? I mean, we tend to think of younger people as being more resilient, that they can fight these things a lot better.
That's true. I think when people die from the flu, it's complications from the flu, and often it's things that you can't anticipate. Children who have underlying conditions like asthma or immune deficiencies, or they're having a lot of fun on the side and they're not really paying attention. They're not hydrating. That's important. They're on two sports teams at school, and they're staying up till midnight doing homework.
Yeah, that hydrating is a big part of that. And I guess when you see them in the hospital, they're past these other symptoms, but the biggest problem is that shortness of breath, that inability the respiratory part of it.
The respiratory part of it, the hydration part of it, so we have to keep them adequately hydrated, adequately oxygenated, and hope that their body will take over and fight it off and pull them through the distress that the influenza is causing and the immune response to influenza is causing too.
You and I were talking about this earlier, and we talked about the idea that we have colder weather during this period of the year. People tend to huddle more together, and it's possible that we could see this thing kind of kick up again, just like, another round, right?
Influenza is transmitted from person to person through droplets. So somebody sneezes, somebody coughs, they aerosolize these droplets with the virus. If someone is close enough, within 6 feet of each other, and they inhale it, then they have the potential of getting the infection.
And that's why when we sneeze, we're supposed to sneeze into the inner part of our arm to keep those little droplets from flying out, right?
Two things. When you sneeze into the inner part of your arm, you're preventing the droplets from flying too far, we hope. And the second thing is, by not sneezing into your hand, the next thing you do, you go to shake somebody's hand, you're transferring the infection to them. So by sneezing in the inner part of your arm, hopefully no one's touching you as much out there.
I want to talk to you about the flu shots. We'll talk about your thinking about holistic medicine in a sec, but the flu shots, I know I get them, and I haven't gotten the flu, knock on wood, right? But do you find that they're helpful, doctor?
The flu shots are a layer of protection, and the way I explain to my patients is, think of it this way: if it works, it's great. You don't even want to get the flu, but it doesn't give you superhuman qualities that prevents you from getting any flu. You still have to exercise common sense.
But there has been a shortage of the Tamiflu, right? The vaccine itself. And so what are some of the alternatives that one could use? I know you deal with a lot of herbal sort of things. I mean, what do you recommend sometimes when you can't get the shot, or you want to have some other way to protect yourself?
Well, if you're trying to prevent the flu, I think that what you talked about in terms of being in crowded spaces and nothing enclosed. I mean, look at the Dodgers. 25 Dodgers went home with flu-like symptoms, which
is that crazy or what?
It is. It's crazy. So even
we're talking about the Los Angeles Dodgers.
That's right, the Los
wondering.
Angeles Dodgers. So so avoiding big space. So it's mostly about avoiding big spaces, taking good care of yourself, like we said, in terms of.
Do we need to wear those masks? We see people wearing them out there.
Yes. And if someone has the flu or has a cold, you don't want to aerosolize it. So one good thing that you can do to prevent, if you absolutely cannot stay home, is to wear the mask while you are in crowded spaces, hopefully reducing the amount of droplets that you are spraying.
Well, when do you think this will all be
people.
over? Is it April, May, June? What are we looking at here, do you think?
The season actually is worse till the end of March, but the season can continue on till May. That's why we are still telling people that if you have not gotten your flu shot, get it. It doesn't mean it's going to protect you 100%, because this vaccine against the H3N2 strain is less than 25% effective.
All right.
But it still is a layer of protection that might work for you.
A layer of protection. Okay, I know there are many other things that one can do. We're going to have to wrap this up right now, but I want to thank both of you, because I think this is something that is clearly a big issue for an awful lot of people right now.